Hello everyone, my name is Charity. Welcome to my YouTube channel.
So today I'm going to be sharing some 5 specific characteristics of the nursing profession that I believe anyone pursuing nursing or anyone interested in nursing needs to know.
The number one S of nursing is that nursing is a profession that prioritizes safety. Safety is huge in nursing. Safety is threaded in everything that you do as a nurse. So when you are, as a nurse, are going to administer medications. So medication administration is one of the biggest roles or tasks that you're going to be doing a lot. So safety in the sense that before you administer medications, we call something the rights of medication administration, and I hope to really address that in another video. But there are certain things that the nurse needs to review before he or she administers medications. And one of them is, number one, you have to make sure that this is the right patient by verifying the patient's name and the patient's date of birth. Because when you work in a clinical setting like a hospital or a nursing home, in a setting of that sort, you're most likely going to be taking care of multiple patients. And it is so easy to make a mistake. So as a nurse, you always have to keep in mind that safety is critical. In everything that you do, you have to make sure that your patient is going to be safe at the end of this task. Number 2 is selflessness. Nursing is a profession of complete selflessness. When you are a nurse, when you go into work, it's not about you. It's about your patients. And this means that you are there to do whatever it is possible and that is required for this patient to get well. So if the patient came in with pneumonia and now they are on an antibiotic, vancomycin, for example, and that vancomycin is scheduled for 12 o'clock in the afternoon, as a nurse, you need to make sure that you administer that medication at that time, because that's what you're there for, to administer that medicine so that the patient gets well enough to go home. When you get to work, like I said, it's not about you. It's about serving another person, you prioritizing another person. Okay?
So it's really, really important that as a nurse, whenever you go to work, just understand that you're there for your patients. So you need to prioritize the times that your patients get their medications, whatever treatments that are due, whatever it is that's required for your patient, they need to be the top priority. You are there for them, okay? And that leads me to the third S, which is service. So as a result of the fact that you are there for your patients, that you are selfless, it's not about you, that it is about your patients, you need to also understand that you're there to serve your patients. Serving your patients means that you are there to do whatever it is that they're not able to do for themselves. Sometimes the patient needs to be fed. Some patients are not able to feed themselves. And so as a nurse, you have to be willing to do that for that patient because you're there to serve your patient.
Okay, nursing is a profession of sacrifice. The reality is that as a nurse, sometimes you have to sacrifice your own conveniences for another person. Sometimes, when I worked in the hospital, a lot of the times, I get to work at 6:30 in the morning, and a lot of times I wouldn't be able to go to lunch until 3 p.m. in the afternoon, 4 p.m. in the afternoon. And it's not because I choose to go to lunch at that time. It's just that it's been busy, and nursing is busy. And I've had patients back to back, patients that are being discharged, patients that are being admitted, patients that are going to surgery, patients that are coming from surgery that I'm receiving. Maybe if you worked in a different field, a different type of a career setting, you can kind of just drop everything and go to lunch or, take care of yourself. But with nursing, a lot of times you can't just abandon your patients and just go. You need to be there to take care of the patient, okay?
My last S is long suffering. So long suffering is actually a biblical word, and it means patience. And patience is key when you're a nurse. You have to just be really, really patient. Sometimes you have a patient who is trying to express their needs, or a patient who is upset, or whatever the case might be. You can't just walk out of the room, and say, I'm sorry, I can't help you. You need to be there for your patients, and you need to really try to hear them out, and you really ultimately have to go above and beyond to serve your patient, ensure that they're safe, be selfless in giving them whatever it is that they require to get well, and then add long suffering at the end of all of that. And so, these are the things that you need to know if you're thinking about coming into nursing. This is just some of the characteristics of the nursing profession. And so I hope that this will help you in your decision-making process. I hope to bring some more content on nursing, and I hope that you will find this helpful. Well, I will talk to you in another video. Bye.